sulfur, Hahnemann's king of antipsorics. According to Nash, it combats all psoric manifestations, as described in Hahnemann's chronic diseases. Itching eruptions on the skin everywhere. Scratching is followed by burning. Burning everywhere, general and local, especially feet. Has to stick them out of bed to cool them. Redness of all orifices, as if pressed full of blood. Lips, ears, nostrils, eyelids, anus, urethra, etc. Exudations into serous sacs following acute inflammations. Weak, faint after hot flashes, followed by sweat, especially at 11 a.m. Modalities: aggravation 5 a.m., diarrhea. Standing aggravates complaints. 11 a.m. aggravation. Close room, open air, bathing, damp, cold weather. Ameliorated by doors and windows open, sitting or lying. We discussed arsenicum album and phosphorus. Both are antipsorics and both have burning. Sulphur completes the trio of antipsorics and the trio of burnings along with arsenicum and phosphorus. So here is what Nash talks about sulphur. When seemingly indicated drugs do not cure, use sulphur, because psora is the obstacle to be overcome. If you now ask me what is psora, I answer in true Yankee style, what is scrofula? Perhaps psora is scrofula or scrofula is psora. Call it either or neither, yet it is present as something named or unnamed, which must be recognized and complicates so-called acute diseases. Now there is nothing so very remarkable about this. Syphilis does the same. Once contracted or inherited, no matter what ordinary acute disease appears, we are at times obliged to turn aside from its treatment to give a quietus to the old enemy before we can overcome the acute infection. So it is with sulphur and psora. Theorizing and philosophizing, no matter how wise they sound, must go down when facts oppose them. See the case of gastralgia under arsenicum and neuralgia under causticum. A sulphur patient is always theorizing, always philosophizing. It's like always trying to construct a big picture out of the details. They're very careful about the details. They pick up all the details and arrange them, and they look at the details together in many different ways. They zoom in, they zoom out, and they try to find the common thread. They try to identify the thing that binds all these things together, and they are always philosophizing, always theorizing, always try to see the big picture out of the details. Now, if you look at arsenicum album, they would get lost in details. They just want the details. And they collect details, but they do not know how to organize these details and to get to the bottom of the thing. And if you look at phosphorus would not be so much concerned about the big picture, but would understand it in a unique way. In a unique way, it's a kind of a feeling understanding, a kind of an emotional understanding, but they would again fail to create a comprehensive theory out of the details that they collect. They mostly are not very picky about the details, not very capable of selecting the details, and also sometimes omit many details. Phosphorus people are scattered. Their mind is diffused. Their mind is scattered. They don't even try to construct a theory out of the details that they obtain. Arsenicum may collect all the details, but would not be able to construct a logical, a coherent theory or coherent big picture, as we call it. But that's not the case with Sulphur. Sulphur is a philosopher in rags, a philosopher who thinks he's a king, feels that he's living like a king. But if you look at that person from outside, they would be dirty. Sometimes they won't even take a bath, and they'll be wearing old clothes, rags, and think that they look handsome or great. Well, if you look at my shirt, this one, I have been wearing this for so many years. I purchased it even before we got married. Like it's more than how many years? 2014, 12 years, and I still use this shirt. And people think that you shouldn't be using the same clothes like for 15 years, 20 years. What's going on? But I don't so much care about the clothes that I wear. Of course, they must be neat, they must be tidy, and I try to keep them as neat and tidy as possible, but somehow I just stick to the old thing, and if you look at me, you would see that I'm not so cautious about looking very nice. But I'm very cautious about thinking correctly. As I said, Sulphur people, they live in their brains, they live in their minds, they live in a different reality. They are just amazed by the amazing universe. They see things, they get lost in the stars, they get lost in the wars, they get lost in many details that are happening around them, and they just want to know why, and they seek how and why of things. They are pure, like, researchers, and they want to get to the bottom of the thing. They go deep into everything. As a deep thinker is Sulphur. So there is another work that I read where one of these people, he's a disciple of George Vitolkas, and he's an Australian man. His name is Philip Bailey, and he says that Einstein could have been a Sulphur patient. We do not know well, because Einstein towards the end had some dementia also, and Einstein was a great philosopher and a great theorizer. And I also feel that Stephen Hawking may also qualify as a kind of a Sulphur patient, though we do not know, causticum or sulphur, which one would help him or would have helped him if he believed that homeopathy is not a pseudo system of medicine. Regardless, these are three antisorics: arsenicum, phosphorus, and sulphur, and the three prominent remedies that have burning as a characteristic. Burning everywhere. Arsenicum, the burning is ameliorated by warmth. In sulphur and phosphorus, burning is ameliorated by cold. Arsenicum is a chilly patient. Phosphorus is mostly chilly. Sulphur is a very hot patient. They wouldn't like hot weather, warm weather. However, both arsenicum and sulphur, they prefer warm drinks. Phosphorus, though they are chilly, they prefer cold drinks because it gives some relief to their burning in their stomach. It's amazing, isn't it? Like how people, we assume them to have a particular symptom that would follow, or a particular habit that would follow the rest of the way they are, but there is a reversal of expectation always, and we are surprised. Well, you said you feel chilly and you want cold drinks. They would not tell you why they want cold drinks. They want cold drinks because it alleviates their burning pain in the esophagus and the stomach. That is phosphorus. And the similar chili patient who craves warm drinks and drinks in sips, we think, well, this is natural, this is normal, isn't it? Chili patient who cannot endure cold would want warm drinks, and they are drinking warm drinks. There is nothing amazing about it, nothing so great about it. But you ask them, what do you feel? How do you feel? Like, what is the kind of pain, the character of pain? We may assume it would be a stinging pain, stitching pain as if somebody is pressing there, but they would come up with a very strange sensation, and it is called burning. They say, well, I feel burning. You feel burning? You don't feel some kind of stitching pain? Or no, I feel burning. And the burning, the patient is articulating correctly. The burning is relieved by warm drinks, and that is arsenicum album. And then you have another patient who also has a burning in the abdomen. They would not tell you that I have burning in the abdomen. They would tell you that I have sudden hunger, and I just want to go and eat a lot of food. And we think, okay, well, he might be pre-diabetic, and we need to do the tests and find the right diagnosis, and then maybe we could treat them. But this has been there for many years. Around 11 o'clock, the patient feels a burning sensation, a burning hunger. Some people call it kalicha in Malayalam. They feel a burning hunger, and they just want to eat something during that time. And they go and eat, and you ask them, so what do you eat? They would say that I am eating very hot food with hot tea. And they also have burning, and that is sulphur. And when you probe into it deeper, they would say that the burning can be relieved by cold drinks also, but I don't know why, I just like warm drinks. The burning, if you drink cold water also, it would get some relief, but I like to drink warm water, preferably hot. If you give me tea, I'll just drink it hot. And this is how strange people are. And these are us. You will find so many phosphoruses, arsenicums, and sulfurs in your practice that you would feel that this is something normal, but that is not true. They are all different. They have different desires. They have different aversions, even with respect to temperature. As I said, phosphorus is chili patient desires cold drinks, and cold drinks relieve their burning. Arsenicum is chili patient desire warm drinks. Warm drinks relieve their burnings. Sulphur is a hot patient with burning. Cold drinks may relieve, but they prefer warm drinks. That is why if you have a patient who is a hot patient, has burning, and they like warm drinks, we would say that, well, we have been prescribing sulphur like anything. So we would just for a change want to think about other medicines which have all these things together, like hot patient, warm drinks, and burning. Which are the other remedies? When we go and look at the Medica repertory, we find hot patient desiring warm drinks would be bryonia, carbovetch, mercor, black, defloratum, and these are the main medicines, and sulfur. And then among these, do you see anybody having burning relieved by hot drinks? Hot patient, maybe carbovetch. The rest of the medicines do not have this characteristic burning. Bryonia pains are stitching pains. Mercury also has stitching pains, ulcerations. And lac defloratum the symptomatology itself is very unique and different from these kind of medicines. And then you wonder what to do. Sulphur is unique. Sulphur, though we prescribe it regularly, it is unique. We may not be differentiating so carefully, but it is still differentiated and it is unique. It is different from arsenicum. It is different from